menopause part 3. And just in case you haven't watched the part 1 and 2, I encourage you to do that, and don't scroll away. Menopause is not only for women. Imagine for a moment, just picture that the word menopause starts with men. And so, yes, menopause affects women directly, but it indirectly affects men. And so men should pay attention to what we've discussed so far and what we're about to discuss in this video. And so here in the part 1, we discussed definition, causes of menopause, perimenopause, and the symptoms. And then in the part 2, we looked at treatment, local, systemic, general measures. In this part 3, I'm just going to highlight what to do about specific situations, like what to do about hot flashes and night sweats. Number 1, wear light clothing. Keep your bedroom cool at night. Take a cool shower. Use a fan. Then avoid triggers such as smoking. We've mentioned exercise regularly. That's also quite important. And then if you're overweight, do lose weight. And then you can ask your doctor to refer you for cognitive behavioral therapy. And then with respect to the bones, it's very important to mention that as women approach menopause, at menopause, the estrogen level begins to reduce based on the definition for menopause, and that predisposes them to having weak bones, or osteopenia, osteoporosis. Osteoporosis is reduced density in the bone, and so they become predisposed to developing fractures. And so in addition to what I've mentioned earlier on, which is weight-bearing exercise, eating healthily in terms of having calcium in your diet with yogurt, kale, and milk, hormone replacement therapy, stop smoking. Very important to mention these other two, which is number 1, adequate exposure to sunlight, because when you do that, it triggers and helps the body to produce vitamin D, and it may also be necessary for you to have vitamin D supplements. And so in this series, we looked at part 1, part 2, and part 3 of menopause. If you do have questions, please leave your questions in the comment section, and I would do well to respond. Thank you, and bye.